Good morning. My name is Amanda Craig, and I'm a first-year maternal fetal medicine fellow at Duke University. Thank you for joining us for this abstract. My email contact is at the bottom of this slide for any comments or questions. On behalf of my co-authors, we are excited to present today on the maternal implications of Listeria in pregnancy. Listeria monocytogenes is a gram-positive intracellular aerobic and facultative anaerobe that can be transmitted by consuming a variety of foods. The annual incidence of listeriosis reported worldwide is between 1 and 10 per 1 million people, with an incidence of 2.4 per 1 million in the United States. Incidence of listeriosis is expected to rise due to changes in the U.S. population. Most cases are reported among pregnant women, neonates, the elderly, and immunocompromised individuals. 1 in 7 cases of listeriosis occurs in pregnant women, and they are more susceptible to acquiring listeriosis when ingesting contaminated food, with a 16 to 18-fold increased risk. This information comes directly from our review article, and after publishing our literature review on Listeria in pregnancy, we observed that the fetal and neonatal outcomes associated with Listeria infection in pregnancy are well known. However, the maternal outcomes are incompletely described in the literature. Therefore, we sought to describe the maternal morbidity associated with Listeria infection in pregnancy. We performed a retrospective cohort of pregnant women using the 2007 to 2016 nationwide inpatient sample. The NIS is an all-payer database comprising approximately 20% of United States inpatient stays. Pregnant women with discharge diagnosis codes consistent with Listeria infection were compared to contemporaneous pregnant women without infection. The primary outcome was a composite of severe maternal morbidity. Secondary outcomes included maternal length of stay, mode of delivery, and preterm delivery for delivery hospitalizations. Associations between outcomes and Listeria status were adjusted for age, hospitalization type classification, either antepartum, delivery, or postpartum, and maternal comorbid conditions using logistic regression, and the data was weighted to reflect the design of the NIS dataset. For our results, nearly 9 million pregnant women were included in our cohort. Of those, 105 or 0.001% of women had Listeria infection. The majority of the infected women were white, accounting for 46%, or Hispanic, accounting for 28%. In Table 1, you can see our data analysis. The first column are some of our maternal morbidities. The second column includes women without Listeria infection, and the third column includes data for women with Listeria infection with our corresponding p-values in the final column. In analyzing our data, we found that women with Listeria infection experienced severe maternal morbidity at much higher rates than those without, 23.3% compared to 2.1%. And in adjusted analyses, women with Listeria had 14.3 higher odds of severe maternal morbidity when compared to those without Listeria. In addition to our primary outcomes, adult respiratory distress syndrome, sepsis, and mechanical ventilation were also markedly more common among women with Listeria. Not surprisingly, preterm birth and cesarean delivery were also more common among this population. In conclusion, we found that women with Listeria infection in pregnancy have higher rates of severe maternal morbidity and longer lengths of stay compared to other pregnant women. Thank you so much for your time and for tuning in to view this abstract. I would be happy to answer any questions that you may have via email or application submission.